Hello, my name is Mark Sherman. I'm a general surgeon practicing at Surgical Associates of La Jolla. That's the name of our medical group. Right across the parking lot is Scripps Memorial Hospital in La Jolla. And I wanted to talk to you just for a few minutes about a certain type of procedure for people who have reflux and heartburn. Now, reflux, when we think of reflux, is when food, saliva, things go down into the stomach and then reflux or come back up into the esophagus. It's not when some people have difficulty swallowing and it never gets to the stomach, but it's really when things in the stomach come back up. The stomach makes acid. The esophagus doesn't like acid. It's not designed for it, and that's why it burns, and that's why people feel that heartburn sensation. And over the years, many different procedures have been developed to try to help with reflux. One of those procedures is something called a TIF, T-I-F. It stands for transoral incisionless fundoplication. So fundoplication is the medical term for using part of your stomach to create what's kind of like a one-way valve so things can go into the stomach but not come back up. Transoral means it goes through the mouth. And incisionless, the idea being that you don't have any incisions on your abdomen with this. My partner and I did quite a few of these. In fact, very early, we were some of the first doing this in San Diego. And we found that some people can actually have a really good result with this procedure. But unfortunately, we found that a few too many people had recurrences of their symptoms. It might take a couple of years, but those symptoms would slowly come back. And what we found was that oftentimes we did a hybrid procedure. A hybrid procedure actually had incisions. We put in laparoscopes, small incisions, and looked inside the abdomen and fixed the hiatal hernia. A hiatal hernia is the opening in your diaphragm that the esophagus goes through to go down in the stomach, gets too big, and some of the stomach goes up into the chest. So we fix that laparoscopically. We go inside the abdomen and bring the stomach down and close that up, and then the TIF procedure can be used to construct that one-way valve inside the esophagus. There are some individuals who do that. In our practice, what we have found is when we do that procedure, there's a fundoplication procedure that we do at the same time that we can kind of avoid doing the TIF aspect, and we've had excellent results, and most importantly from my standpoint is very good long-term results. I would really like you not to have to come back to the office because you're happy and you're doing well, you're eating a sensible diet and the things that you enjoy, and most importantly, no heartburn. And the reason why no heartburn is important is it means you're not taking heartburn medications. And just as a minor little thing, I'll close by saying those heartburn medicines can be great to stop the acid in your stomach, but that's not a good long-term solution. Your stomach is designed to have acid in it. And in fact, our body's physiology is designed for your stomach to have acid in it. And there are some significant and concerning long-term issues about keeping your stomach free of acid. And so those medications can be good for the short term, but my recommendation is that if you need those, and you have many years ahead of you, as I hope that you do, that you consider an operative procedure so that you can get off of those medications. If you have any questions, please don't hesitate to contact our office, give a call, check our website, or of course, look at our YouTube channel. Take care.